Hello, and welcome back to the Chaplain's Compass, a podcast for interfaith chaplains where we navigate the waters of spiritual care and chaplaincy. This is our first episode in 2025, and I'm super excited about today's episode. I think it's going to be a great way to kick off the new year. I know you will enjoy it. I am Alicia Tremaine.
And I'm John Betts. Yeah, we're really excited because we have Dr. Kelsey White. Kelsey has a PhD in public health services and also a Master of Science in Clinical Investigation Sciences from the University of Louisville, not Louisville, Louisville, please. We got to pronounce that correctly. She completed her theological degree at Union Theological, and Kelsey is also the first female editor-in-chief of the Journal of Healthcare Chaplaincy. Dr. White also co-authored a book of peer-reviewed publications about chaplaincy that I find extremely helpful when I'm teaching on chaplaincy. It's called The Evidence-Based Healthcare Chaplaincy, a Research Reader. So we're really excited. I'm also excited because Kelsey and I were among the first cohort of Transforming Chaplaincy Research Fellows. So, Kelsey, thank you so much for agreeing to be on here. And I can't wait to hear more about what you're doing, your thoughts, and the great work that you've been involved in.
Thanks for having me. It's an honor, and I'm very excited to be with you all today.
Yes, welcome, Kelsey. I know you a little bit, but I don't know your whole story. So it's always interesting to us to learn from our guests about what brought you into chaplaincy and spiritual care in the first place, and then how your role has evolved and changed over the years. Can you tell us a little bit about your background?
Yeah, absolutely. So I went into my Master of Divinity right out of college, thinking that I was going to work in a church. And as part of that training, I heard a lot about my classmates doing CPE and how important it was for them. And some of them it was required. And I thought, I don't really want to work in a hospital. I don't want to do direct spiritual care in that way, but I'm going to give it a shot because it sounds like it'd be an important skill to have. And when I did that, I fell in love with chaplaincy and spiritual care and felt like I was actually, helping other people in ways that I hadn't really envisioned before. So from there, I decided to do a residency. I actually did do a couple of years. So it was like a year and a half in a church before I did a residency, just to make sure that that's exactly what I wanted to do. And did my residency at University of Louisville Hospital. Of course, fell even deeper in love with chaplaincy and spiritual care, and took my first chaplaincy position at the University of Alabama at Birmingham Hospital and their large outpatient facility.
Oh, wow. Yeah.
Yeah, their outpatient facility was seeing like 2,000 patients a day. And I was the first chaplain, and they said, just go figure it out. I said, okay, and had at it. 5 floors, every clinical service line you could imagine, from chemotherapy to doing paracentesis for liver patients to transplant clinics to primary care. Yeah, so that was my first out of residency clinical experience. And how that kind of transitioned into research was that I said to my supervisor at the time, hey, look, I can't cover this whole place by myself. This task is crazy.
Well, maybe they think that you could. That's
I think, it was at that time that everybody was really trying to branch spiritual care into outpatient. And those initial conversations about the need to have spiritual care in ambulatory settings, and the director of the department at the time was just really good at kind of networking with those executives to make the case for spiritual care in that setting. So it was just like this, let's get a foot in the door. In that conversation, that process, I said, okay, we need to figure out how to make the case that essentially everybody who wants professional spiritual care can access it. And that has driven me ever since. And from there, I decided, I took some positions working with the grant program. It's a very long, tedious process or a tedious story. Well, so I started by managing a grant.
Oh, yeah. Wow.
I was managing like an outpatient palliative care grant and doing spiritual care for the palliative care population. So I shifted from being all outpatient to just this palliative care outpatient and community-based and grant manager, like all in one hat kind of position, and learned a lot about research and being involved in that grant. And when I decided to shift and apply to a job in Kentucky for personal reasons to be closer to some family. That's kind of I started working at Norton Healthcare there in Louisville, and at the same time as when Wendy Cadge and George Fitchett got the big Templeton grant. And I was like, "I'm doing it." After all I had learned, I was like, "I'm doing it."
So what was it about chaplaincy that really drew you? Like, why did you like chaplaincy?
I felt like the one-on-one relationship with the individuals I met, whether they were staff or patients or families, I could tell that in that relationship, the care I was providing or even just the reflective listening, empathetic, like, engagement meant something to them, right? Like, I think at the core of who we all are is that we wanna do something to help or to make the world better. There's some part of us that really we're driven to that, regardless of how that kinda manifests in a practical sense, and I think for me, it was spiritual care really made that come to life.
No, that's a beautiful way of saying it. I love that.
And research, I think, and just it takes it even one step further for me too.
I totally interrupted you when you were talking about, you did the transforming chaplaincy. Then we're at that phase of when you were blessed to meet me.
Gosh.
So it's like humble. But no, all jokes aside, yeah. Then you did the transforming chaplaincy project. So how did that transform you?
So when I was in college, I was a religion major, but I was also, oddly enough, a math minor, and people always looked at me like I was this odd duck for pairing these 2 things. But getting into that Master of Science program and learning more about research, and in as much as I'd taken tons of math classes, I actually never taken a statistics class ever until that master's degree, and I said, "Oh," and it finally just put all of these puzzle pieces together for me that I hadn't thought about before then. Like how you can use numbers and stories and these different processes to really illustrate a story to multiple audiences and to different aspects of chaplaincy and healthcare. And I always thought of my supervisor when I was in that outpatient setting being like, well, we got to make the case. How are we going to make the case that we need more of you? And
So I think chaplains are really good with stories and telling the stories of those relationships that you were talking about. It's the other part that I think may be scary or unknown or unfamiliar to chaplains. And I don't know if there are common pitfalls maybe out there that you've seen or maybe that you've done yourself when you were starting out in chaplaincy research. What would you say are some common pitfalls in the area of spiritual health research?
in terms of some of the pitfalls I've seen and talked about with colleagues is this assumption that when it comes to research, everyone has to be doing it or leading it, when really there are probably, different levels of engagement with research. It may be that, being research literate or just being aware of the research that's out there that you could use, in your everyday clinical practice is one level. Maybe you want to be engaged with colleagues from other disciplines and the, kind of innovative things that are coming out if you're an oncology chaplain in the field of oncology, or to even just be engaged from the sense of watching and learning. I think one of my favorite stories is hearing from a colleague who said he had a clinical colleague reach out to him about wanting to do some study. And he said, okay, well, yeah, we can support you in that, but I want to be a part of this and I want to watch and I want to learn. And so from there, that just is how he got involved in research. And so I think just assuming that you have to do it or lead it is a pitfall. But and to think it's a solo venture, right? So research is a communal effort. It is not a solo venture, and I think oftentimes people assume that that's really what it's all about, is me doing it by myself, and, that's not it.
You're absolutely right. It takes. I mean, one of the things that I've always told people, because people always come up to me and say, "How do I get involved in research?" Well, find out what research is happening around you and see how you can plug in. Like, how did you get plugged into research, Kelsey?
It was through the Templeton Fellowship, and depending on how you wanna define research, right? When I was the outpatient chaplain, as silly as it sounds, I took an Excel class to figure out the different ways I could use Excel to keep track of what I was doing on a daily basis. And it just kind of opened my eyes to the different possibilities of just keeping track of what I do and then thinking about it in a way of like, oh, when somebody in a paper reports on trends over time, granted, there's some advanced analysis occasionally there, but essentially that's what I was doing, right? So that's kind of, I mean, as simple as it is, that's really what brought me into thinking about spiritual care in that way.
I love that, bringing in that math piece to bear and to give voice to what do we do? They're numbers, we shouldn't be afraid of numbers. I was also thinking about, Gianni Grossamy, he has a BS in, astrophysics, to which, chaplains come from all different. I have a music degree, so, I can sing to people, but when it comes to actual math and science, some of those voices, people can use your gifts to be able to add the, quantitative to the qualitative piece.
Yeah. I also think that often, especially, and this is a pitfall that I fell into early in thinking about a research agenda or thinking about some research goals I had. I thought about it like a sprint, like a professional sprint, when really it's if my research goal is to improve access to professional spiritual care services, that's like 20 marathons pasted together. It's not a sprint. It can't be done with one study, and it takes a whole professional career to address some of these things we think can be done in one study. It's and that dissemination and advocacy, so not just doing the research, but letting everyone know what you found and preparing for even doing it, and advocating for the implications. I mean, those things are 80% of the work, not the actual study itself. Because once it gets in a journal, that's great, but how do you make people aware of the fact that it's in a journal? Besides Paul Galschuch, sharing it on LinkedIn every day.
Yeah, he is good at that.
He's very prolific on that. So, going with that, what are some of the areas where our research really lacks vigor? Where would you like to see when somebody turns in a paper, or when somebody when you're reading an article that's specifically for spiritual health, chaplaincy, spiritual care, religious studies having to do with healthcare or other research? What are some of the areas where you're just like, oh, I would have loved to see this?
One of professional spiritual care's gifts is this, like, and I'm talking about the body of professional chaplains out there, right? And I think some of our strengths are we are incredibly innovative and incredibly like creative in the development of how we can be integrated in really complex settings, how we can address really complex challenges. And at the same time, if we keep so when it comes to research, we want to get research to be generalizable, applicable to like a wider kind of population rather than one specific community. That's important too. I'm not trying to dismay the like contextual importance of different efforts, but the more generalizable evidence we have, the more we can say overall spiritual care is beneficial for quality of life, for extended mortality, right? And so, in as much as chaplains are this innovative and creative, like workforce and developer of interventions, we don't tell those stories enough, and we don't retry out other people's innovative experiments in new settings. So, for example, there's a case study that has been published about godly play. You guys know godly play. Right, the storytelling intervention for often used with children to tell typically a biblical story with figures without a lot of commentary. And I've actually been trained in godly play back in the day, a long time ago. And this case study is fascinating. It's well written. It's thoughtful and provocative, but at the same time, nobody else, or if they have, has tested out godly play in other settings. So, you know, we need to see more testing of things we already know we do in other places to really show like, hey, this does impact XYZ, or this does help with ABC, or it is feasible, it's acceptable, people like it. So that's what I would say really would be great for chaplaincy research in general, is to expand on what we already know.
Right. And take somebody else's innovation, best practice, and apply it to your setting. Yeah, I love that.
And even just, write up what you do that may be innovative. Like there are probably a million things that chaplains are doing out there that are creative, influential, and changing the way healthcare is delivered. But we don't know about them because nobody's written about them.
I wonder if a lot of chaplains feel like what they're doing is not worthy of research. So there may be a confidence level there. I don't know. But how often do you get submissions, and what gets you excited when you get a submission in your, what piques your interest?
Yeah, so I would say for the journal, I would say we probably get 5 to 10 submissions a month, maybe. Of those, there's always 2 to 3. This is what makes me often laugh the most, that have nothing to do with chaplaincy. They're like cellular biology or something, like nobody read the scope of the journal and they just submitted it. And it's often quite hysterical what I get. But in terms of like what gets me excited, I always get excited about quantitative pieces because I'm a numbers person. But that's just my personal excitement, not necessarily excitement for publishing in the journal. When it comes to like publishing in the journal, what gets me excited is when I see folks whose names I don't know and who have done a really good job. We have certain folks within our profession who publish a lot, and that has shifted our profession in monumental ways. And at the same time, I love when I see names of people who I've never heard of before, but have written really, unique and fascinating pieces. Yeah, and I think you're right, Alicia, about, people not thinking it's worth writing up, you know? And I would encourage them to, like, send me an email. Say, "Hey, do you think I should write this up?" Or, "Will you read this? Will you read this and see if you think I should submit it?" I do that all the time.
I've done that once, but then I didn't follow up, not with you, but another journal, and then I didn't follow up and I didn't write it up. So maybe that's a little nudge to me, like,
Yeah, you should write it up.
because the editor did write me back and said, yes, we would publish that.
Yeah. I think there's a lot of hesitancy, and I don't know if it's fear, I don't know if it's invisible, like, barrier between, "Oh, I don't think I could ever be published." Like, well, you don't know until you try.
Yeah.
True.
Well, and going with that, what are some of the favorite pieces that you've published? Like, what are some of the pieces do you ever it's kind of like people in Hollywood. There are some people where they like to watch their own movies, and some people, they're just like, "No. I spent way too much time doing that. I never wanna revisit that." You can tell kind of where I lean toward. I'm kind of the person, "Okay, yeah, that brings up old memories. I'm good. Yay, published, but let's move on." What so do you find yourself really excited about, what are some of your favorite articles? And
I probably lean more that direction too. Like, once I submit something or get it done, I'm like, I need to put it aside and not look at it. I often like to use my articles with students to show them like problems. Let's think critically about this. Like, what is wrong with this assumption or this statement? But no, um, I think something, an article that recently came out in the journal that had me really excited was one by Sarah Knapp and colleagues that did a literature review. I love literature reviews, by the way. Most people hate them and hate doing them, but I think that they are I would spend every day, all day doing them if I could, because you get to paint a picture of a landscape of work with those, and really, people have time to read 500 articles or 200 or bit like 20 articles. Pulling that together to help synthesize information and paint this picture, I think is one of the most phenomenal things. And that doesn't require a bunch of research training either. But Sarah Knapp and colleagues wrote about spiritual care for clinical colleagues and the things that chaplains do to take care of clinical colleagues. And it makes me so excited because, some of George Fichet's early commentary about, the direction of spiritual care research mentioned that as one of the growing areas and how there wasn't a lot of published research. And then in this literature review, it just kind of shows this blossom of information and things that have been really expanded upon.
That's awesome. You were talking about literature review, and another question came to mind for me, which is, what do you see as the role of AI in research right now? Because that's one of the things that AI is doing right now is you can give it all these journal articles to, Chat GPT or what is the notebook, OpenAI, and it synthesizes for you. What are you seeing?
That too, I feel like we could spend hours discussing. And in the realm of publishing articles, there hasn't been a lot of clear guidance on, how authors should and should not engage with AI. And there are so many resources out there. I've used a whole bunch of them in terms of looking at and analyzing our existing articles and seeing what articles are connected to what other articles, as well as like generating summaries of different parts of articles. And all of those resources are fascinating. I would caution anyone using them, especially if you're using it for something really important, for lack of a better word, because it'll often get things wrong. It may, an effort to not plagiarize or not to repeat word for word what the study author said, it will make a statement that is inaccurate. And so you always kind of have to go back and check. Yeah. I mean, I think it's a great resource. I think it'll speed up a lot of resources, or it'll speed up a lot of research that's done in different professions. But, I think we're at the kind of infant stages of AI and research, honestly.
Yeah. Did you hear about the story of I believe a there's a lawyer who used Chat GPT to write their brief to a judge, and the judge, it just cited cases that didn't exist. And the judge was like, I've never heard of this, and started looking it up and called out the lawyer. And I think the lawyer got into some huge trouble on that. So no, I agree. AI is it seems like it's one of those areas where it's kind of like training wheels. Like you should probably use them, but it shouldn't you shouldn't rely upon them so much.
Yeah, I've been playing around, and one of the tools that I look at occasionally cited an article that actually didn't exist. And that's kind of how that technology works, though. It just gobbles up any and everything it can get a hold of and then regurgitates it. I don't know that it always regurgitates it in a accurate manner.
So, how do you recommend that chaplains who are, they're getting a little interested in how they can be involved in research? And you talked about how it's a communal effort. I think, John, both you and Kelsey mentioned, just observing research that's happening around you. What are some other ways that you would recommend collaborating with others on publication or just research?
Find somebody who's doing things you're interested in and ask if they'd mentor you, or if you can even just have, a brief conversation with them about their work. One of the gentlemen I worked with in my master's science degree actually found his research in the university newsletter. He was doing some research on prayer, and he had collected data, and I just emailed and said, "Hey, can I come talk to you about your research and what you're doing?" And, we had a few conversations, and he was like, "Absolutely." So I think that's always a great way to get involved, is just connect with somebody or some folks. And it doesn't have to be a chaplain. I think there are a lot of resources outside of chaplaincy that their insights, input, and experiences will only enrich what we can produce as chaplains.
True. And people probably are usually happy to talk about their work. I mean, I know people can be busy, but I would say most people are generous. Is that what you found in the research community, or?
Say most of the time, yeah. I mean, you do have your occasional, like, grumpy Gus, but for the most part, people are pretty willing to talk about what they do. And one of the chaplains that's in a PhD program now, that's how he and I got into a relationship mentoring. He called me up and he's like, "Hey, I see you doing this stuff. Can I talk to you about it?" And I said, "Sure." The other thing too, though, I would say is that writing, just write. Writing helps you write. It's in an iterative process, and not to get too emotionally attached to what you write, and to know even writing's a communal process. It's something that requires all of us working together, even people who publish articles that have just their name on it, I can guarantee you 3 to 4 other people have read it and provided feedback and edited and deleted, and I think that's also probably an important consideration.
What are some of the exciting things happening within chaplaincy research? It's a huge question, I know, but like, what are some of the things that get you excited about what you've seen coming through the Journal of Healthcare Chaplaincy, or what's happening within chaplaincy research?
I think one of the really robust growing edges that I see in the literature is this evolution of spiritual assessment. So you have a lot of spiritual assessment models or intervention approaches. So you could talk about spiritual aim, you could talk about sky, the Ankh-5, the PC-7, right? All of these, now granted, even before these, there were iterations of spiritual assessment that have been published in literature. But these models that are coming out now are ones that have been robustly developed to have, for the most part, a mix of quantitative and narrative documentation. So they've been robustly developed, but then also tested multiple times. And it's exciting because one of the challenges that has always existed in spiritual care and spiritual health research is being able to translate spirituality from the clinical delivery to the research world, um, when the definitions, it's much broader in clinical practice. So like the way we think of how somebody's spiritual or how they identify as with their purpose or meaning and how they connect is very broad often clinically. And then when it had, traditionally in research, it'd been even more narrowly conceptualized, right? Spiritual well-being, spiritual coping, religious coping, right? But then when we think about some of these spiritual assessment models that are evolving and being published on more and more, I really feel strongly that they do a really great job of kind of bringing those two worlds into conversation.
What does it mean for an assessment or something like that to be validated? Is it this process of testing in different places, or what validates something?
Right. So when somebody develops an instrument, also known as sometimes they call them surveys, or I mean, we need a whole class on this, right, John?
Oh yeah, that would be fantastic. Yep.
It's like 20 classes. I don't know. So you want to know that, let's say I have an instrument that measures how happy you are. I want to know that instrument that measures happiness can reliably measure happiness over and over and over and over again in the same way, as well as actually is measuring happiness and not some other idea, such as lack of sadness, right? So there are ideas that can be related. And so to do that, researchers will test these instruments over and over again in different settings with different populations, and then do some fancy statistics occasionally to say that, it does do this. It does work. They'll often compare it to other instruments that measure other ideas. It's can be often very time-consuming and complex to do that. But that's what's exciting about these spiritual assessment tools, is that they're actually looking at those things.
Yeah, testing the reliability and the validity is extremely, yeah, it's this wonderful tension to maintain, because yeah, something can be extremely uh reliable. You get the same thing with every single same person's delivering it, and the population, various different populations, but it's not really measuring what you think it's measuring. So being able to do that, that's extremely important. That's good. Yeah. And I agree that that might be a fun at a conference. Let's teach an 8-hour intensive on that.
Yeah, it's all you, John.
Yeah, yeah.
Can you walk us through the process, Kelsey, of, okay, you got a submission, you're going to evaluate it. I don't know what criteria you use to okay, now it's published. What does that look like?
So for the Journal of Healthcare Chaplaincy, we focus on publishing research articles, so original research, empirical articles, meaning things that have been observed, right? And I also will consider literature reviews that follow pretty rigorous guidelines. So when somebody submits an article to the journal, it comes to me into my little inbox of articles, along with those that talk about, cellular biology. And I look at all the submissions. I make sure, the names match, that the article they submit has the same names as the names in the portal. I check to make sure that there's a blinded copy, so a copy that doesn't have any identifiers, as well as a unblinded copy of the manuscript. I make sure it's formatted per the journal standards. And then I'll send it out to review. And it's really important that it's blinded, because we do at the journal a double blinded peer review process, which means the authors don't know who's reading their work, and the reviewers don't know which authors are reading it. And the reviewers don't know what authors they're reading.
They're revealing.
Yes. And we usually have at least 2 reviewers look at every article. And once the reviewers look at every article, or look at the articles they've been assigned, they provide me with their feedback. I will do my own review to provide any comments that may need emphasizing or things that somebody may have missed. And we'll send it back to the authors, usually to make revisions. And typically when it comes to a decision, I will lean on all of what the reviewers say to make that decision. It's not a me decision. It's a communal decision. And there's a remarkable team that the journal has for editors. So I may be the editor in chief, but Jason Nusma is the senior associate editor, and then Paul Galshut and Gila Rajai, 2 other Transforming Chaplaincy fellows, are 2 of the other associate editors. And they often do the same process I do, except for the check-in to make sure names match process as part of the review once somebody submits an article.
How do you find your reviewers? Are they part of your team, or?
No, so the journal has an editorial board, and sometimes I lean on those folks to review. Reviewers typically come from pools of previous authors, or someone who has published on a topic, or who I know has experience with a particular topic. Like, somebody recently submitted an article that was about an intervention with indigenous communities, and I had to find somebody with that kind of expertise. So I'll often have to go look for reviewers with expertise related to the topic submitted.
I know a lot of people are continually chasing after, like, where do I go past the MDiv? Where do I go past my the basic education for somebody who has become a chaplain? What's the next step? So what kinds of education would you recommend for somebody who's interested in going and doing research?
First of all, I think it's important to talk to somebody, again, chaplain or not, who does it, to really find out if that's something you want to invest your time and energy in. And if you find yourself in a place of, okay, I'm bound and determined to get more into research, it often depends on, what area or topic you're specifically interested in. I will also, advocate for the Transforming Chaplaincy Research Literacy 101 and 102, as well as their Chaplaincy Research Summer Institute. Those programs are really chock full of resources to help you explore if you want to get into research more, especially if you consider yourself somewhat research literate and excited. Those are great next steps. In general, the challenge with an MDiv or a Master of Theology is that those degrees didn't really provide you with research training at all. So inevitably, let's say you are bound and determined to become a researcher and want to do that, you're going to probably need another master's degree. Occasionally, you can jump into a PhD if you already have a master's degree. I personally would recommend thinking about, even if it's a 1-year master's degree, on whatever area you're interested in. So, for example, talked to a woman recently who's going to do a PhD. She's been pediatric chaplain, and what she's most interested in is really kind of spiritual psychological interventions with pediatric patients. And so the PhD she has decided to enroll in is is a psychology PhD. And there are some PhDs that really teach research methodologies and design and implementation really well. Most psychology programs are typically like that. If you don't know, I'd say look at public health. I think public health is a great, great starting place, like a Master of Public Health. And go from there. I think that the Master of Public Health really gives you a good survey of health in general. But so it really depends. And then having conversations with mentors and colleagues too. I will also say, and I know somebody's gonna like curse at me when they listen to this. I would also say that in-person PhDs are gonna be more robust than virtual PhDs. I know that that's easier said than done. And somebody's cursing me right now. And I didn't have a virtual PhD, so maybe I don't know, but there's something about that community, even working with those professors in person, that strengthens, I think. Again.
No, well, and I've wrestled with that, Kelsey, because like I'm in a full-time position, and the tough part about full-time PhDs is they usually say, "That's great, you've got a job. Quit your job and come work for us full-time." I also get that the kind of PhD that I would receive then with that kind of intensive training over 4 years would be different from the kind of training that I receive from a distance-based where I'm perhaps writing and studying 15 hours a week in addition to doing my job. So I can see there is that great tension. So I hear what you're saying.
Yeah, so a few things, John. Anybody who you would have to quit your job to go do a PhD, they better be paying you, meaning you better have, a research or a teaching assistantship, and they should be covering like tuition and fees. Like any PhD that's in person that's not doing those things is not, in my opinion, not worth the time based on what you're going to have to give up. There are hybrid programs, hybrid PhD programs, right? So one of the PhD programs we have here in the College of Health Professions at VCU is a hybrid program, and the semesters are very different. They're like 6-month semesters. And you come for a week at the beginning of every semester and the end. So 2 weeks a year, you're here in person. You actually get that time with professors and faculty, and you have the benefit of the remote learning. So I'm a huge fan of that program, obviously, because you get the both. And there are a lot of places that do hybrid PhDs, which I think is also a good avenue. And the one thing I didn't mention is to make sure that if you're looking at programs, that you look for a faculty person you could work with, who you could get along with. And something that's often not said is somebody who is communicative. So faculty and programs all over the place are so busy, right? You want somebody who's going to have time to talk to you. If you're going to need help, like you want to be able to have somebody answer your question, not wait like a month and find out.
So maybe talk to somebody who's been through that program.
That too. That too. Yeah, absolutely.
I also find somebody where they're currently studying what you want to study, because typically when you approach a faculty member, you're going to be studying what they're studying already. You can approach them and say, "Hey, I think this is interesting," but a lot of times I go, "That's awesome. I'm working on this. How can you plug into this?"
It just depends on the school though, because when I did my PhD, they had things they were studying, but I said, I'm going to study this. And they were like, okay. So I did. And they supported me. And what was really rich about the experience is that they could critique what I was doing from a different lens. And I think only made those efforts stronger. So I think it just depends. And that's, your interview of the program is, like they say, just as important as their interview of you.
Kelsey, I hope that this has been really encouraging and inspiring to chaplains who have been curious about research or publication and just had some questions about it. But also maybe to those chaplains who are, feel like they're so busy and overwhelmed with work that they don't have time for research. Maybe this has made it a little more relevant and less intimidating to think about and to learn from research. We always like to end with this question, but before I ask, I just want to ask if there's anything else you want to say to our listeners.
Yeah, I think, to your last point, Lisi, about folks that may just be like overwhelmed already with what they have in front of them in terms of really engaging in research is to consider case studies is a great starting point for even just reading research. George Fichette and Steve Nolan have 2 books out, spiritual care case studies. It helps, especially folks just starting into becoming research literate, think about what they do and the stories and then they have in terms of research.
Yeah, we'll probably put a link to that in the doobly-doo below to those 2 books because those are great books.
They are. They are. And I use them with my students all the time.
So, Kelsey, what is giving you life these days? Because nothing is happening these days, in the world.
I would say 2 things. I love to read, but things that have nothing to do with chaplaincy, like fiction, fantasy, historical fiction, sci-fi. Like, I love to read. I recently finished Kristen Hanna's book, The Women. Y'all, that was so good. It was so good. I also can say I've read some really trashy novels, which, you need to. I also shoot a compound bow.
Oh, that's awesome. Yeah. What's your weight? Like, what's the weight that you pull on?
I think last time I was like 37 or something. Nothing crazy, but it's really a meditative and like breathing exercise for me. Although recently my son had me try and take down an old wasp's nest with my bow, and
Wow. Katniss Evergreen over there.
those things are adhered really well. It was not coming down. But it's a really good meditative and focused kind of experience. I write so much for my papers and the research and the things I got to put out beyond that writing. I don't write. Only because I'm always writing for other things, and I think if I started writing for just like reflective purposes, it would come out like a research article.
Yeah, I get it.
Kelsey, thank you so much for your time and for everything. It's been wonderful to be able to connect again, but also to hear where you've come from and also just your thoughts on chaplaincy and research in general.
Absolutely. Thanks for having me. And anyone who wants to email or chat, you all can share my email address and they're welcome to reach out anytime.
Oh, great. We'll add that to the show notes. Yeah, thank you so much. I learned a lot, and maybe I've been inspired to write some more or at least think about research a little bit differently. So hopefully your listeners too.
I hope so.
And now is the time for the non-anxious presence with Elise.
And John, Alicia, it's been a great time to discuss with Kelsey and hear a lot of where she's come from, but also see where she sees chaplaincy going, and just a lot of where research can take us.
You know, there were a couple of things that I think stuck with me from that conversation, but one of them wasn't really all about research. It was something she said in the very beginning when she was talking about her background, which was she didn't call it this way, but she described basically a mission statement for herself. She said, I wanted whoever needed or wanted spiritual care to get it. And that's been guiding me ever since. And that's such a clear mission statement. I find very inspiring. And I can totally see how what she's doing in research and editing the journal is fulfilling that mission. And that mission is driving her. So I am curious sometimes about other people's mission statements, and I try to craft one for myself for my work or personal life, and I try to edit it sometime, but I loved how clear and just simple that is.
And you can really see how that has influenced where she has taken a lot of her experience and the research that she's done, and how she helps to serve with the Journal of Healthcare Chaplaincy and at BCU. Yeah, I loved how she talked about the simplicity of simply telling the story of what we do as chaplains. What are some things that are already happening that we could just describe and write up so that others might be able to learn from what we're doing? Just everyday things. She had used godly play, but is there what other things do we do that we don't give ourselves credit for?
The other thing that stuck with me is when she said, just write what you're doing and track what you're doing. And it reminded me about I had a very simple writing practice years ago when I was serving as the palliative care chaplain, among other things, at the hospital where I worked at. And I had a journal where I would just write a little bit about what I did during the day, but I was very intentional about writing any words of affirmation that I received or any special moments when I connected with a patient or a family member or expressions of gratitude that I received from patients and things like that. So I was just the other day, I found this journal and it's now like 10 years ago, really, I think almost. And I started reading and I was like, wow, I was doing such meaningful work. I'm so glad I wrote this down. And just some of the things that I was doing were really incredible. But in the moment, I was just writing my regular day, like this happened today. But looking back, I was really grateful that I had written, but also those were things that I could be writing more about, just instead of just jotting down this happened today. So it just made me curious about what can I be writing about and how can we really tell those stories because chaplains really do some really incredible things and they have such an impact on other people and those stories need to be told. People need to know that.
They do. And also not feeling that we have to remain so siloed away from other disciplines and also from each other. So finding is if there's a mentor out there or somebody who's done something, you're like, I love what this person has done. How can I plug in with this person? And just maybe it's as simple as, hey, I want to learn from you. Can I buy you lunch? And trust me, like anybody will take a free lunch. Well, not ever anybody, but if somebody says, I'd love to take you out to lunch, I'd be like, let's do that. That sounds delightful.
And hopefully that's what we're doing with this podcast too is elevating those voices, letting people know about what's happening in their context, things that we might try in different contexts, telling those stories of chaplaincy. I think that's been a big goal for this podcast and also to share some of the research that's been happening. One really great thing is that we've had a lot of you write to us and leave voicemails. So I want to thank you so much for that. We do listen to every voicemail. We read every comment that you leave us on social media. We read every review that you write on Apple or Spotify. We're so grateful that people are listening, that it's helping, but also for all the questions and requests that you've been sending to us. I'm not going to list all of them or remember all of them off the top of my head, but we take notes. So for instance, we've had people ask, can we talk about patients who are hoping for a miracle or, what is the hope for a miracle in medical futility conversations. We've had people talk about can we talk about when patients bring up the end of times and apocalyptic conversations and how to navigate those? And I think some of the requests that we've gotten, we've actually had guests because of those requests. So one of those examples was somebody asking for military chaplaincy conversations, and we had chaplains from the Army. So we are listening, and we're working to fulfill those requests, and hopefully get you some answers that you've been thinking about, and maybe don't have a lot of time to do the literature review like Kelsey has talked about.
If you want to do that, please leave us a message because we do listen. You can call us and leave a message at area code 502-536-7508. That's 502-536-7508. We are on Facebook at Chaplain's Compass. We're also on Instagram. And look us up also on apchaplains.org. That's where you can also find our podcast. We're also on anywhere, Spotify and Apple products. You are welcome to go on there. And, it makes a huge difference to leave those reviews, subscribe, give us ideas because this is your podcast as much as it is ours.
Absolutely. But thank you so much.
So the time that this is being recorded is there's a lot of change happening within the United States. And so one of the pieces that I wanted to highlight was the desire us to ensure that what we are doing and how we are voicing ourselves and serving our nation is done in a way that's responsible, but in a way that ensures that all voices are heard. I thought it'd be an appropriate time to end with a quote by Representative John Lewis. And he said, "Do not get lost in a sea of despair. Do not become bitter or hostile. Be hopeful. Be optimistic. Never, ever be afraid to make some noise and get in good trouble, necessary trouble. You will find a way to make a way out of no way."
I love that. Go get into some good trouble, y'all. But be kind. We love you. Blessings.
We love you.
Bye.